Endocrine system. As the name is suggesting, the secretions, which are basically the hormones, will be secreted inside the blood vessels. So the name is endocrine, means they are not using ducts. Normally the glands will be exocrine if they are using the ducts, and if they are putting the secretions into the blood directly, then endocrine. Endocrine system is under the hypothalamus, diencephalon part of the brain, and this hypothalamus is basically controlling the endocrine system. Endocrine system itself is controlling the homeostasis of the body. So body must have the constituents in balance, and that is the internal homeostasis maintained by endocrine system. Basically hypothalamus is controlling the master gland, which is pituitary, and the pituitary itself will be then controlling the further glands in the body. We will be talking about the gonads. We also have to look upon the adrenal, and we are also going to talk about thyroid and parathyroid gland as per the type of questions we are getting. Let us first focus upon pituitary gland and its effect on the gonads. Gonads means basically, if you talk about the male, it is the testis. If it is female, then it will be the ovary. In the testis, you will have hormones like testosterone, and if we are talking about the ovary, we will have hormones like estrogen and progesterone. But then to give these hormones, you need the pituitary. Pituitary itself is under the hypothalamus. How they are being controlled, how this axis is controlled, and how the feedback inhibition is working. There is a hormone called inhibin, as the name is suggesting, it will be inhibiting. So feedback inhibition, how does it work? We want to talk about in a flow diagram. You see here that central nervous system, which is the hypothalamus region, we have magnified it here, is giving us gonadotropin releasing hormones, and these gonadotropin releasing hormones basically work upon the pituitary. So as you see, positive sign, they are working on the pituitary. Let us zoom this area. On the anterior pituitary. Anterior pituitary then give us hormones like luteinizing hormone and follicle stimulating hormone. Follicle stimulating hormone may be male or female, they will be stimulating the follicles. Like in the ovaries, you have the primary follicles, secondary follicles, tertiary follicle. But in the male, it will be basically working upon the testis, and in the testis, they have this positive sign on Sertoli cell. So Sertoli cell is going to help us in spermatogenesis. It is the nurse cell which will help in spermatogenesis, but sometime you may find that there is too much of sperms, means crowding of sperm. In that case, it is also secreting inhibin. Inhibin is feedback inhibition, as you see, negative sign on the anterior pituitary, so as to reduce the FSH, and as the FSH is reduced, you will see that the sperm production is also reduced. So it is feedback inhibition. We can write here that inhibin, which is secreted by Sertoli cell, is feedback inhibition. It is going to inhibit, negative sign as you see, on the anterior pituitary, and to reduce the FSH, so that you reduce the formation of the sperm. Now the same story you will find in female also, which we can draw a diagram. But before you draw the diagram for female, you can also talk about this hypothalamus giving you the gonadotropin releasing hormone stimulating the anterior pituitary, and which will give us luteinizing hormone both in male and female. In males, luteinizing hormone, as it comes to a testis, it will be working on the Leydig cells. Leydig cells, they start secreting testosterone. Leydig cells also help in formation of spermatogenesis via testosterone, but testosterone is basically for androgenic effects, secondary male sexual characters. It will also be anabolic in nature. Now, if we have too much of testosterone, we'll always have a feedback inhibition, and which works on hypothalamus chiefly. Number one, the testosterone which you are secreting, if it is too much, if it is in excess, it will have a feedback inhibition, and that feedback inhibition chiefly works on hypothalamus, which will then reduce the gonadotropin releasing hormone, which will then reduce the luteinizing hormone, which will then not stimulate the Leydig cells, and accordingly testosterone will go down. This is feedback inhibition. But then this Leydig cell, when it is giving testosterone, and if you have too much of testosterone, it can always go back and work on the anterior pituitary also, negative. So feedback inhibition works on anterior pituitary also. Thus you'll again reduce the luteinizing hormone. You'll again ask the Leydig cell to reduce the testosterone, feedback inhibition. But remember, testosterone chiefly works on hypothalamus. This is your first answer. And secondarily works on anterior pituitary. That is your second answer. The hypothalamus is always first answer for testosterone feedback inhibition, whereas you have seen inhibin works on anterior pituitary. Now what about females? If you look at the females, you'll have this ovary. In the ovary you'll have these oocytes. Around the oocytes you'll have these granulosa cells, and those granulosa cells, they are working under FSH. Now this FSH, as we understand, will be given by anterior pituitary. So anterior pituitary gives two hormones, LH and FSH, and FSH works on the name is telling, follicle stimulating hormone. So it was stimulating the follicle. This is the follicle here, which could be primordial, primary, secondary, tertiary follicle. And then we know that granulosa cells which are surrounding it, these are the granulosa cells. So granulosa cells which are surrounding it, along with the theca cells, will be giving hormones like you have the estrogen. Now estrogen is working primarily in the first half of the cycle, and it will prepare the endometrial proliferation. That is the job of estrogen. And estrogen is also working for female secondary sexual characteristics. Estrogen also help in mammary gland development, especially the duct system. All of these are MCQs. But then these granulosa cells, they are secreting inhibin also, because if you have too much of estrogen, you want to inhibit it, and it will go back on the anterior pituitary, and it is feedback inhibition. Similar way as you have already seen here, Sertoli cells giving inhibin, which is feedback inhibition on the anterior pituitary, so that you reduce the FSH, and hence you will reduce the formation of sperms. The same way, the granulosa cells, they in female secrete inhibin, which will be feedback inhibition on the anterior pituitary. You will reduce the level of FSH, and most of the follicles will be inhibitor except one follicle, because only one follicle should develop during each menstrual cycle to give us the secondary oocyte as ovulation. So that is how, if you want to just block other follicles and just one follicle should develop, you should have little bit decrease in FSH, and that is being done by the inhibin in female secreted by granulosa cells. Now let us say ovulation happened and one secondary oocyte was released. What you have is corpus luteum after that, and this corpus luteum which we have can become corpus luteum of pregnancy if you have already fertilization done, and it will be, corpus luteum will be giving us progesterone basically, and little bit of estrogen also. This progesterone is important. PP, progesterone is the hormone of pregnancy. It will prepare the endometrium for implantation. So endometrium is being prepared for implantation. But then remember that you cannot have too much of progesterone. So if you are having too much of progesterone, it can always go back and work on the hypothalamus level, though it can always work on the anterior pituitary also, similar to the fashion as we told testosterone. So maybe it is testosterone, or maybe it is the progesterone, or maybe even it is the estrogen. They work the same way. How? Testosterone, estrogen or progesterone, they chiefly work on hypothalamus, reducing gonadotropin releasing hormone and reducing the luteinizing hormone, even follicle stimulating hormone. That is how. So maybe you have excess of progesterone or estrogen. What do? They can always go back, work upon hypothalamus. Secondary, they can work on the anterior pituitary to reduce the luteinizing hormone. The secretions which are there can be reduced by feedback inhibition. All that is important to deal with the MCQs. So this is the diagram which we have seen, and let us proceed further to look at this question. This question, January 2025, asking which of the following hormone is inhibiting FSH? Now maybe you are talking about a male, where we have seen Sertoli cell giving us the inhibin, or maybe you are talking about a female where we have seen the granulosa cells giving us the inhibin, but that was feedback inhibition on the anterior pituitary. So inhibin is our answer. Now when you say inhibin is your answer, B is your answer, fine. What about the progesterone or testosterone or estrogen if they are in excess? If they are in excess, they can always go back and work upon hypothalamus. So there will be feedback inhibition on the hypothalamus, which will then reduce the gonadotropin releasing hormone, which will then reduce the activity of anterior pituitary, so that you are reducing the activity of LH and reducing activity of FSH. LH works on corpus luteum, so the activity of corpus luteum is going down, so you will have less of progesterone. On the other hand, if you have less of FSH, then you will be working on the granulosa cells and less of estrogen. So you are reducing the estrogen level, you are reducing the progesterone level in female. And if in male, we already have seen it can reduce the activity of FSH, reduce the sperm production, and also it can reduce the LH hormone and reduce the, because Leydig cells are giving testosterone, you can reduce the testosterone. So progesterone, testosterone, estrogen basically work by feedback inhibition on the hypothalamus, not directly on FSH. So for FSH, we'll keep our answer as inhibin, choice B. Now as you see, July 2024, primary action on inhibin. So we already have seen the inhibin is to inhibit the follicle stimulating hormone, which was being done by anterior pituitary. It actually is giving negative signal to anterior pituitary. If you talk about this choice number D, it is the way the estrogen is working, the progesterone is working, or even the testosterone is working. They work chiefly upon the hypothalamic releasing hormone, means they will reduce the gonadotropin releasing hormone. As you reduce them, anterior pituitary will reduce the FSH and LH secretion also. So choice D is valid for estrogen, progesterone, testosterone, but our answer should remain choice number C. That is, inhibin works on anterior pituitary for inhibiting FSH secretion. There comes a question, lactating mother, hormone responsible for breast tissue growth. Breast tissue means you can talk about the alveoli, which are for secretions, milk secretion, or you may be talking about the ducts, which is to conduct the milk to the nipple. So if you are looking at the mammogenesis, means the development of mammary gland, of course you will have to talk about a lot of hormones like estrogen. Estrogen works chiefly on the duct level. Progesterone, if you are talking about the progesterone, progesterone will work on the alveolus level, though it doesn't mean that progesterone is the only hormone to work at the alveolus. Estrogen will also help, but specifically if you want to specify, then that is how it is. Plus there's a hormone prolactin. Prolactin is given by anterior pituitary. In the anterior pituitary, you'll have lactotropes, and those lactotropes, they are giving us prolactin. Prolactin is helping progesterone for the development of alveoli and estrogen for the development of the ducts. Prolactin is also for milk production, which is lactogenesis, and it is also for galactopoiesis. Galactopoiesis means maintenance of milk secretion. So maintenance of milk secretion, or lactogenesis means initiation and production of the milk. That is the job of prolactin. Prolactin is inhibited by dopamine. That is also to be remembered, because when we talk about pharmacology, this will help. Now point is, in lactating mother means post delivery. Post delivery, we understand that the hormones like the estrogen and progesterone will go down, they go down. So that cannot be your answer for breast tissue growth. So what should you answer? In that case, since the estrogen is down and progesterone is down, because this is a lactating mother post delivery, you don't have these hormones in much quantity. That is why your answer should be prolactin. Why not oxytocin? Oxytocin is for ejection of milk. It is not for breast tissue growth. So the point is here, when we are talking about the alveoli development, means these alveolar ducts which produce the milk, basically here it is the progesterone working, little bit of estrogen working, but also prolactin, especially post delivery. Now if you are talking about these ducts chiefly work under estrogen help in, means during puberty, progesterone and estrogen they work during puberty or even during the childbearing age, or the when there is pregnancy, the baby is inside mother. So estrogen working here on the ducts, but then prolactin is also working, especially post delivery. That is what we have to remember. So if you are telling that prolactin is also important, that is post delivery, that is why in this question, look at the question, in lactating mother means it is post delivery. Pre delivery progesterone estrogen are more in concentration, so they'll be helping, but post delivery estrogen goes down, post delivery progesterone goes down. Oxytocin is for milk ejection reflex. The baby is suckling on the nipple. As the baby is suckling on the nipple, then milk will come, that is milk ejection. That is the oxytocin. But here, lactating mother, hormone responsible for breast tissue growth, maybe alveoli or ducts, your answer should be prolactin. On the other hand, if you look at this January 2025 question, which of the following hormone is responsible for the act shown in the image? What is the act? Breastfeeding. So when you are breastfeeding the baby, that is the act. Which hormone is working? That time you have to tell oxytocin. Oxytocin, which is working for milk ejection reflex, as the baby is suckling on the nipple, and this is going to the brain, and then oxytocin starts working for milk ejection, release of milk. If you look at the pituitary will have two parts, anterior pituitary and posterior pituitary. Hypothalamus has some nuclei, paraventricular nucleus and supraoptic nuclei. These paraventricular supraoptic nuclei of hypothalamus, they secrete hormones, like one of them is oxytocin and the other is antidiuretic hormone, or also called as vasopressin. These hormones, number 1 and number 2, they are then given to posterior pituitary, and posterior pituitary will secrete. So posterior pituitary, which is also called neurohypophysis, will secrete these hormones, but actually they were formed in the hypothalamus. So hypothalamus having some nuclei, paraventricular supraoptic nuclei, there you have number 1 oxytocin formed, number 2 antidiuretic or vasopressin formed. From there they are transferred to the posterior pituitary or neurohypophysis, and then they are secreted. So what is the job of number 1, the oxytocin? Oxytocin is for ejection. If you look at the oxytocin, it is for ejection of the baby. It will increase the uterine contraction and send the baby out, that is for delivery. Number 2, ejection of milk also. As the baby is out, baby need food, so ejection of milk. So ejection of baby by uterine contraction, ejection of the milk by working on myoepitheliocytes around the alveolus of the mammary gland, so that you can squeeze the milk out. That is, we are telling oxytocin is the answer. Thyroxine is for the metabolism in the body, and it is given by thyroid hormone. Prolactin, as we have told, when there is suckling, prolactin will also be activated, but prolactin is basically for the lactogenesis, means milk production. It is also for galactopoiesis, means it is to continue producing milk. It is also for mammogenesis, especially post delivery. So these are all features of prolactin, and but not the answer for this particular question. Antidiuretic hormone, what is it doing? Antidiuretic hormone or vasopressin is the second hormone given by the hypothalamus. As the name is telling, antidiuretic hormone, so it will reduce the urine output. So water conservation, it is for water conservation because it is antidiuretic, and that is the job of it. Will concentrate the urine and reduce the water outlet from the body through urine. Antidiuretic hormone, antidiuresis. But anyway, in this question, we should keep our answer as oxytocin, because this is the act of breastfeeding, and in breastfeeding, the baby suckles on the nipple and oxytocin released and milk is released. So choice D is the answer. As we proceed further to thyroid parathyroid gland, we have some diagrams, you can see them. See here, these nuclei, you have to focus upon these nuclei, spherical, central spherical nuclei. So when we are having a cell which is a central spherical nucleus, it is cuboidal cells, and these cuboidal cells, as you will mark, they are lining the thyroid follicles. These are the thyroid follicles. Here you will have thyroglobulin. The thyroglobulin is the secretion by thyroid gland, and it is giving us the T4 hormone for metabolism, as we told. So follicular cells are simple cuboidal epithelium, but remember, this simple cuboidal epithelium is going to change into, say, this is the basal membrane and columnar, oval basal nucleus, more of endoplasmic reticulum, if you are hypersecreting. So actively secreting thyroid follicle, a question comes, then what is the epithelium? That time the epithelium is columnar. What about the normal thyroid follicle? Normal thyroid follicle, it is simple cuboidal. So what you are looking at is simple cuboidal cells. This is one thyroid follicle, this is another thyroid follicle, and if you look at the cells, spherical, round spherical nuclei. So inside they will secreting thyroglobulin. So simple cuboidal cells, they are the answer. The follicular cells are simple cuboidal if they are asking the thyroid follicle are lined by. Your answer is simple cuboidal. But if they ask actively secreting thyroid follicle, then it can become, because you will have more of endoplasmic reticulum to give the secretion, it will become columnar. What about a resting follicle? If question comes on resting follicle, you will see why the follicle will be resting, because there is too much of colloid. The thyroglobulin is too much, so it will press on the cells and cells will become flat. So then it is simple squamous epithelium. So simple squamous epithelium can be your answer for resting thyroid follicle, because now first of all it is resting, means it is not secreting. So you don't need much of endoplasmic reticulum, cells become flat with flat nucleus. Moreover, there is so much of secretion that was pushing the cells to the periphery, so flat. Point is, thyroid follicles are lined by simple cuboidal. Actively secreting thyroid follicles are lined by simple columnar, and resting thyroid follicle is lined by simple squamous epithelium. But here you can see some bigger cells as evident by their bigger nuclei, and they are lying between follicles. They are the perifollicular C cells, clear cells. They are large cells and they have large nuclei as compared with this nucleus. This nucleus is large and they are between the follicles. So parafollicular. Now if we are talking about these parafollicular C cells, parafollicular means on the sides of the follicle you have parafollicular C cells. First of all, they are large, and second thing, they are lighter staining, and third thing, they are given by neural crest cells. Neural crest cells will give us the parafollicular C cells, and they will give us the C hormone. C hormone means calcitonin hormone. So thyrocalcitonin is the other name. What is the purpose of thyrocalcitonin? Thyrocalcitonin is contradicting parathormone. So how it will be contradicting parathormone? It is for calcium homeostasis. The calcitonin or the thyrocalcitonin will reduce the blood calcium. How they will reduce the blood calcium? By stopping the osteoclast from doing bone resorption. So they stop the osteoclast, and also they increase the secretion of calcium by kidney. So how the parafollicular C cells are working? Parafollicular C cells, they are antagonizing parathormone and they will reduce the blood calcium. How do they reduce blood calcium? They are stopping osteoclast from doing bone resorption, so that more of calcium remains in the bone, not comes into blood. And they are also increasing the secretion of calcium from the kidney, so that you have hypocalcemia basically. That is the job of parafollicular C cells, and that is what came as a question also. July 2024, December 2021, you have this question asking the marked cell which hormone they are secreting. The hormone they are secreting is of course thyrocalcitonin, because the cells which you are showing is parafollicular C cells of thyroid. So you will keep your answer as calcitonin. What about thyroxine? Thyroxine is here, thyroglobulin. It is by the follicular cells, not the parafollicular cells. What about adenine? Adenine is given by adrenal cortex. It is by adrenal cortex, not by thyroid or parathyroid. Prolactin is given by lactotropes by anterior pituitary, and thyroxine is by thyroid gland, means the thyroid follicle cells and not the parafollicular cells. So that is why we will keep our answer as calcitonin here, choice number B. Now, as we move on to adrenal gland, you see adrenal gland will have a capsule. This is the capsule, collagen fibers capsule, and then you will find alternate bands of dark and light color. See, this is a darker band, then you have a lighter band, then you have a darker band, and then you have a lighter band. So four things. The first thing, 1, 2, and 3 is adrenal cortex, and this is adrenal medulla. Adrenal medulla is also identified by the fact that it will have a large blood vessels. Of course, the hormones are being secreted here, so large blood vessels is the identification of medulla. Of course, in the cortex also you have blood vessels, but they are smaller. In the cortex also you will have blood vessels, but they are smaller. So, looking at the blood vessels, you can tell that this is the cortex and this is the medulla, because medulla, as you can mark now, you see the medulla is having large blood vessels as compared with the cortex. So this one, this one, this one, large blood vessels. So this is medulla. Now once you say this is the medulla and that is the cortex, cortex will have 3 layers: G, F, R, zona glomerulosa, fasciculata, and reticularis. So how will you identify zona glomerulosa? Glomerulosa, like renal glomerulus, you have bunches of cells. You see bunches of cells like glomerulus, they are forming zona glomerulosa. And what about zona fasciculata? Fascicles of cells, sheets of cells, sheets of cells. You can draw themselves. You see glomerulosa, if you say bunches of cells like this. Fasciculata, you will have sheets of cells like this, sheets of cells running parallel to each other, and in between you will have blood vessels. So sheets of cells, fasciculata. Here you have bunches of cells, glomerulus, zona glomerulosa. What about reticularis? Reticulum, network. The cells, they are making kind of a network. So network of cells, that is why the name is reticularis. This is the adrenal cortex. And then you remember the secretions as the salt, sugar, and sex. You will notice that these zona glomerulosa is giving us mineralocorticoids like aldosterone, that is working for minerals, mineralocorticoid minerals like sodium, chlorine, potassium, etc. Maintenance of the blood volume and also minerals, basically blood pressure also, renin, angiotensin, aldosterone system, all that. We know that aldosterone works on the distal part of the nephron, on the DCT, and also on the collecting tubule. Basically, first it is conserving the sodium, and secondly it can conserve the water also. So mineralocorticoids. What about the zona fasciculata? Fasciculata, first of all, you will see that it is lightly stained. Why it is lightly stained? Because these cells are having a lot of, see, all these cells are fat based secretion, so they are having less of staining, but the cells of fasciculata are having a lot of fat droplets, so they take light stain, and the zona fasciculata is larger as compared with glomerulosa or reticularis. So a larger area and lighter area is zona fasciculata, and it is giving us glucocorticoids. Like chronic stress, cortisol is released, chronic inflammation, glucose metabolism, that is why sugar. So there it was salt, so sodium conservation by mineralocorticoid. Here it is sugar, so sugar metabolism or glucose metabolism by glucocorticoids by zona fasciculata. What are zona reticularis? Reticularis, you'll have the sex hormones like DHEA, dehydroepiandrosterone. So when you are talking about dehydroepiandrosterone, it is for secondary sexual characteristics, basically androgenic. It is androgenic male characters, but if you have tumors, that female also can have, they can develop secondary sexual characteristics of male. So this is about the zona reticularis, the sex steroid. What about the adrenal medulla? Adrenal medulla, first of all, you should know that it is coming from neural crest cells. It is the neural crest cells which will give sympathetic neurons. These are sympathetic neurons and they give catecholamines, and these catecholamines are mostly epinephrine but also norepinephrine. So adrenaline and noradrenaline, more of adrenaline, less of noradrenaline. Fight and flight reaction, in emergency fight and flight reaction, you immediately get release of adrenaline, and that is done by the adrenal medulla coming from neural crest cells, the sympathetic neurons giving us catecholamines. All of these are MCQs. Now, as you see, this is July 2024 question, hormones secreted by the arrow marked region. So if you are looking at that arrow mark, first of all, you see this is the capsule. This is the capsule. You should always read the options like mineralocorticoid, glucocorticoid, adrenaline, androgen. You know that it is something about adrenal gland, and in adrenal gland you will have a capsule, collagen fibers. Deep to that, you see this area, this area. It is not too much, but this area, that is the G, zona glomerulosa. Fasciculata is always larger and lighter, and this is reticularis. So GFR, that is adrenal cortex, but they are not focusing on adrenal cortex, they are focusing on adrenal medulla. That is where the arrow mark is. How do you know it is adrenal medulla? First of all, it is deeper, and look at these large blood vessels, So these large blood vessels, they tell us that it is adrenal medulla. Now, if your arrow mark is on the adrenal medulla, what is it secreting? Emergency, it is adrenaline. So in emergency, we know fight and flight reaction. So whether you are fighting or taking a flight, running away from the fight, will have more of adrenaline and less of noradrenaline. That is why in our question, this arrow mark, these large blood vessels, this alternate bands. I told you under the capsule you will have alternate bands. This is the darker band, this is the lighter band, this is the darker band, this is the lighter band, this is a darker band, and that is a lighter band. Comparatively means you have to train your eyes. The first three, number 1, 2 and 3 will be cortex, and number 4 will be medulla. So this is adrenal medulla basically, and that is why in this question we should keep our answer as adrenaline. Mineralocorticoid is the salt. So GFR, zona glomerulosa, this area. If you say glucocorticoid, glucocorticoid is the sugar. Sugar is the zona fasciculata. This is zona fasciculata. And if you are talking about the androgen, will have this one, zona reticularis, DHEA, dehydroepiandrosterone. That is number 3, reticularis. But since the arrow mark is on this area, we'll keep our answer as epinephrine or adrenaline.